I am Dr. Sanjay Goja, Director and Clinical Lead, Liver Transplantation, HPB Surgery and Robotic Liver Surgery, Narayana Health. Narayana Health includes hospitals in Bangalore, Kolkata, Gurgaon and Mumbai. The indications of the liver transplant in adults are essentially, one is chronic liver disease which is decompensated. Second is a type of liver disease where you have acute-on-chronic liver disease. Third is somebody has an acute liver failure. Fourth is if you have liver with cancers. You see, as I said that liver transplant is needed in a chronic liver disease when it is decompensated. Decompensated means the person develops deep jaundice, his water in the tummy is not controlled by the medicine, he has repeated episodes of altered sensorium, he has repeated episodes of blood vomiting. Then if he develops the renal dysfunction along with the chronic liver disease, or he develops a lung dysfunction, what is called hepatopulmonary syndrome, he needs a liver transplantation. Also, if somebody has a liver which is acutely failing, there is a short duration where bilirubin goes high, coagulation, derangement occur, and a person becomes comatose in a very short illness, what is called acute liver failure. That time, the transplantation is maybe only solution. And the third group is when you have a chronic liver disease and you develop tumors in the liver, then the treatment is liver transplantation. Although surgery, resection or other radio may be also modality, but if you have relatively advanced stage of the liver disease or you have multiple tumors in the liver which have not spread outside the liver, then the liver transplant is the best option for you. Essentially, the liver transplant is of two types. One is deceased donor organ transplant and another is living donor liver transplant. The deceased donor organ transplant is again of two types. One is donation after cardiac death and donation after brain death. In India and across many parts of the world, it is the legalized is after brain death only. And in European countries and US, the deceased donation after cardiac death is also legally allowed, but it is not in India at present. Majority of transplant in our part of the world are living donor liver transplant, one where someone in the family who is related to the patient donates a part of the liver to the recipient or the patient. Since liver regrows, it has a regenerative capacity, that makes it safer to undergo living donor liver transplantation. There are many ways that transplant in adult differs from the children. As I said, children are very small, so the requirement of the liver is very small. So it is only a small part of the liver which they need. Usually in living donor, left part of the liver small, or in the deceased donor, it is a split part of the liver. Then the spectrum of the disease needing the liver transplant is different. There are some inborn disorders or enzyme deficiencies or metabolic liver diseases which are in children where the liver transplantation is needed, like your biliary atresia, tyrosinemia. The type of tumor like hepatoblastoma is different as in adults. So indications may be different. Then the outcomes of the transplant in pediatric or better worldwide than adults. The standard is to be 95% survival. Also, they need to have a strict follow-up because they have the predisposition to developing some tumors, what are called PTLDs. So the follow-up, there are long span of life, there has to be long follow-up. In adults, although it also needs follow-up in the long term, essentially prevent infection and for modulation of immunosuppression, but children, it has to be lifelong surveillance. You see, I told you the transplant is of two types. One is deceased donor, where it is not essentially he has to be related in the family because this is through the organ allocation system. Living donor, it has to be the family and it has to be either first or second degree relative. First and foremost, he should be first or second degree relative. Then he must be between 18 and 55 years of the age. Blood group matching. RH factor does not count in liver transplantation, so positive and negative does not matter. He or she should not have any chronic medical illness. Then the amount of the liver which goes to the recipient and the amount or the size of the liver which remains in the donor, they should be adequate for the donor. Also, it should be sufficient, the part which we removed, for the recipient according to his demands. At the same time, the quality of the liver, it should not be fatty, fibrosed, or there should not be any chronic liver disease in that donor. His anatomy and architecture should be suitable for the donation. Liver transplant being a complex procedure, there are a battery of tests we need to be performed to make it a success. The tests start from first diagnosing whether this patient really needs a transplant, to look at the decompensation, to look at whether the patient is acutely liver failing or he has developed tumours. So the test is directed to all those things. Then there we have to make sure that other organs are going to tolerate such complex surgery and they are going to take it, like cardiac fitness, lung fitness. All organs have to be fit to tolerate such big surgery. So workup is to be directed at all those things. You see, there are precautions pertaining to the recipient and precautions pertaining to the donor. For the recipient, the most important thing is to have, one is prevention of the infection, then second is the medication. You see, after liver transplant, the most important thing is immunosuppression, so that the body of the recipient accepts the organ from other person. So a person should not falter on the immunosuppression. At the same time, when you are taking the immunosuppression, it makes you susceptible to the infection. So any slightest infection or indication of infection should not be taken lightly. As the infection which are very innocuous to a normal person can be a killer for a liver transplant recipient. So prevention of infection and medication, they are most important things in the post-operative care of the recipient. Regarding the donor, it is like after some time liver regenerates fast. He has a scar, so in initial periods he cannot lift the weights, so that there is no incisional hernia. Rest his life is absolutely normal. As I said, after liver transplant, one of the most important killer is infection. So the post-operative care for prevention of infection, especially during the initial months, is very important. That is why it is very important when should he go back to the work. It depends on the type of work he does. It also depends on how much precaution he is able to take at his workplace. But usually till 3 months, we don't allow patient to resume his normal duties. After 3 months, he can slowly go back to his work, but he cannot be involved in any active physical labor for 6 months. During this going back to the work, he has to take extreme precautions for prevention of infection. He doesn't have to go to the crowded, dusty places near a person who is carrying some infection like common cold. You see, immediate success rate of the liver transplant is around 90% across the globe. That is for living donor as well as deceased donor transplantation. For pediatric liver transplant for children, it has to be higher, around 95% immediate survival. So survival is like immediate operation and then 1 year survival. The 1 year survival, as I said, is dictated by many more things. So 1 year survival is slightly less than the immediate survival. See, success of the liver transplant depends on, one is the performance of the surgery, patient selection, and how sick patient is pre-operatively. Sicker the patient, worse are the outcomes. That is why it is essential for all patients with the chronic liver disease to take early decision for liver transplant once they are decompensated. The signs of decompensation are if they develop fluid in the abdomen which is not responding to the medicine, if they develop repeated episodes of altered sensorium, if they develop repeated blood vomitings, high jaundice, or their kidney functions deteriorate, or they develop respiratory symptoms. If somebody waits long for these, so that the liver deteriorates very high, the outcomes may be poorer. Any patient who in the pre-operative period carries infection or his other organs are affected, the outcomes are poorer compared to the chronic liver disease patients who are decompensated but who have well preserved other organ functions. At the same time, most important thing is the surgical outcomes of the particular institute where the surgery is performed. And third and most important is post-operative care.